Hello everyone, my name is Leon Ledego, and this week, Fred Omondi, a 15-year-old boy from Kisumu County, is admitted at Gertrude's Children's Hospital. Doctors tell me that he needs a life-saving surgery for a rare disease that we are yet to find more about.
Majina naitwa Fred Omondi, niko na miaka 15 na natoka Kisumu. Nilianza kugonjeka mwezi wa pili. Nilikuwa ati mgongo nauma, natapika. Sasa ndio ikifika asubuhi nikaambia mama siko vizuri. Mama akaniambia kama uko vizuri twende OC. Tukaanza OC, tukaenda private. Nikatibiwa kwa wiki moja, nikarudi nyumbani. Nikakaa nyumbani for 4 days. Siku ya 5 ugonjwa tena ikarudi. Sasa mama akaniambia ati tusiende private sasa, twende Jaramogi huko Kisumu. Huko ndio tulienda. Ndio nikatibiwa, napata niko na growth kwa kidney. So walikuwa wanataka kunifanyia surgery. Ilikuwa inawezekana huko, sawa akasema wanataka kunitafutia hosi nyingine huko. Ndio wanafanyia hiyo. Sasa wakatafuta ndio tukapata hapa Gertrude wanaanza nifanyia.
Fred ni mtoto wangu wa 4. Niko na vijana 2 na wasichana 2. Fred ndio kitinda mimba yangu. Saa hii ugonjwa ilianza Fred mwaka uliopita mwezi wa 7. Alikuwa nasikia kiuni na muuma, anatapika damu, alafu alikuwa na sweat kabisa. Akivaa manguo inakuwa tu maji yote. Ndio hiyo safari ya hiyo ugonjwa wake ndio ilianza. Nilimpeleka private ingine hapo penye tunaishi. Wakajaribu ikamshindikana. Nikaenda Russia, Jaramogi Odinga. Nikamaliza mwezi moja hiyo ya Januari. Wakanipatia discharge nikatoka. Kumaliza tu kwenda nyumbani nikamaliza siku 3. Tena hiyo ugonjwa ikaanza, nikarudi Jaramogi Odinga. Nimemaliza huko miezi 3. Niko tu Jaramogi Odinga. Saa Mungu ndiye amefanya. Nilitoka huko Jaramogi Odinga Friday, ndio Saturday nikakuja hapa.
Our patient today had a diagnosis of pheochromocytoma, which is a tumor that produces some of the normal hormones in the body but a very high level. So the patient usually ends up having very high blood pressures. It's a very rare condition in children, but we have seen a few in the country. So it's a high risk case because the patients usually have very high blood pressures, and during surgery those can actually go up and down very fast. Therefore you require that you have anesthesiologists who are capable and who are skilled in being able to manage the blood pressures throughout surgery. Okay? Yeah, so we started the journey with the patient a few days ago when the patient was admitted in the hospital, what we call the preoperative preparation. So we have been seeing the patient, preparing them, ensuring they are stable before the day of surgery, which is today. So we are also involved in asking for investigations to ensure we look at how the patient is, monitor their blood pressures, and also involve other doctors in case we require the doctors in other specialties to be involved to stabilize the patient. So by today morning the patient was stable and we brought him in. So we have actually, we actually usually discuss the patient beforehand to ensure we are all on the same page with the rest of the team, the anesthesia team, the nursing team, the surgical team. Yeah, so this particular surgery also requires a lot of investment in terms of the equipment, the medications. They are not the usual medications we use every day. So we have to plan with the hospital early to ensure that we have procured everything we require, and we are grateful that we were provided with everything we need in terms of equipment and in terms of drugs and medications required. Also, unlike the other surgical patients, these patients require more monitoring. So we shall have to monitor the blood pressure through what we call invasive monitoring, minute by minute blood pressure, because that is usually what gives us problems during the surgery. And also monitor their blood volume and blood state throughout. So we are able to do that in theatre here. We don't have to step out. We all have all the equipment that is required to do it within the theatre. So that is part of what the anesthesiologists have to go through throughout surgery, monitoring the patient, picking blood samples and monitoring what is going on throughout the surgery. So the other common, very important thing for the team is communication. So you see that during the surgery there's a lot of communication between the surgery team and the anesthesia team, yes, because sometimes when the surgeons are handling that particular tumor, because it produces hormones, they can actually affect the patient. So once in a while we have to tell them to stop handling the tumor so that we stabilize the patient first and then they continue. So there is a lot of communication between the two teams to ensure that we are all keeping the patient at as much as stable level as possible. Yeah. Okay.
Talking of communication,
Yeah.
I see there are a lot of waves right behind you on some screen. Would you break it down for us? Kenyans usually wondering, they see them in movies,
Yes.
and they usually wonder, what are they all about?
Okay.
And how do you read them?
Okay. So we basically monitor various components of the patient's well-being during anesthesia. So when you are awake, you're not under anesthesia, your body is able to take care of you. But when we give our medications, then we suppress some of the things, so we are supposed to look at them. So when you see the green, the first green wave is the heart rate. It gives us the heart rate and then gives us the wave of how the heart is beating. So that is one of the important things for this particular patient, because whatever tumor they have can produce hormones that actually affect the way the heart beats. Okay. Then you have the next line is the blue wave, is the oxygen saturation. So this we monitor for all patients under anesthesia, because once we take away the breathing of the patients and they are on machine, we are always supplementing oxygen. So we want to know that the oxygen is at the normal level that is able to support the patient's body. And then we have the blood pressure monitoring, which is the red wave. And for this particular patient, there are two ways we are monitoring the blood pressure. You can see the two numbers in red. The one on lower is the one we are monitoring. The usual one you'll go to hospital and they measure for you is the lower number. And then the upper one with the wave is what we call invasive blood pressure. That one requires special equipment and monitors for you the minute to minute, second to second blood pressure as you go on. So if you have high risk patients like this particular patient, you have to do invasive monitoring so that you are able to see what is exactly happening to the blood pressures as you go. Okay. Then you have what we call the central venous pressure. This the other blue line. This basically monitors the patient's fluid volume. You know, all of us have blood, so sometimes if the blood volume is low, it affects the patient. So it helps us to know, do we need to give the patient more fluid or not to keep the patient's blood volume normal. And then we also monitor the temperature throughout, because that is also affected. We want to make sure it's normal. Okay.
It's not very easy surgery, and more so particularly for the anesthetic team. You've seen the way they have really been working very hard to maintain the physiology of that baby. Episodes when the blood pressure was going very low, because of the medications they had to give to prevent it going very high. There's a point at which the heart also was getting too excited, because when we are holding on the tumor, it's discharging a lot of those chemicals that overexcites the heart. But overall, we managed to access the tumor through what we call a subcostal cut or incision. And luckily enough, the tumor was not attached to many of the surrounding tissues, except what was immediate soft tissue. We were able to free it from the liver, and from the kidneys. with very minimal bleeding. What the kind of bleeding we've had is really very minimal for this kind of surgery. Overall it went well. We've done it in less than the 3 hours, but because of the teamwork. So we are happy. The anesthetic team is of course working on bringing up the blood pressure, which is very important. I mentioned to you again earlier that once you remove the tumor, because the body was used to those high chemical levels, the pressure goes down, and you've seen that exactly what's happened. So we just want to close our incision, and the anesthetic team will take quite some time trying to get the baby out of anesthesia, and we arrange to transfer this patient to ICU. Hopefully in the next 24 to 48 hours, if we are able to get out of ICU, it will be good to take the child to the ward and recovers from there. As far as surgery is concerned, it's going to be another 24 or so hours before we can start feeding the baby, the child.
And just perhaps for someone who's wondering, what is the recovery period going to look like? How long will the patient take to fully recover?
It will depend on how he wakes up from this anesthesia. It can be very stormy. As I've said, the body systems were used to high blood pressures. Now suddenly the high blood pressures are gone down. So yeah, but within the week we should be able to get out of hospital if all goes well.
For Fred, the pain has just subsided. Doctors here say that everything looks promising and he gets to live another day happy and healthy.